So the topic of my presentation today is mindfulness in the profession of caring, where the heart and mind matters. I have a disclaimer first. I'm just a geriatrician and not a mindfulness expert. But I've gone through mindfulness courses conducted by NG, that was like 3 to 4 years ago, and have sort of embraced mindfulness as a way of life. And this presentation, or rather this sharing session, is in fact to depict the reflective journey in my mindfulness as a healthcare worker in the profession of caring. And hopefully those not in healthcare may actually glean some insights from these reflections and introspections. And I hope that we learn together. All right, so the content of my talk today is divided into 4 parts. I'll be talking about profession of caring, what it means, the heart and the mind, mindfulness in clinical practice, a way of life, and finally, reflections of a healthcare worker. So for the first part is profession of caring, what it means. So I like this quote by Michael Josephson, where he states that a caring heart that listens is often more valued than an intelligent mind that talks. And I think this really resonates with me very much. So this diagram actually tells the audience that these are the various interactions that I have at work as a geriatrician. So first and foremost, the most interactions I have is with patients and caregivers, both in the outpatient clinic and also during ward rounds. And then we have interactions with seniors and juniors in the office and also during ward rounds. Then my clinic assistants, and also the multidisciplinary team, where in the geriatric department, we work with a lot of other healthcare professionals like the nursing team, the allied health services, like for instance, the therapists, social workers, dietitian, speech therapists, psychologists, pharmacists, and finally, not forgetting the administrative assistants of the department and also the operations executive, where they really help us with our administrative duties. So you can see that it's not just about caring for patients and caregivers, it's also caring for your co-workers and also your colleagues. So let me give you an idea of how a clinical consult for a geriatric patient is like. So the consult time for my follow-up visits is about 15 minutes. So you imagine seeing the elderly coming to the clinic and having to manage them for about 15 minutes in the outpatient setting. So what I had to do was trying very hard to listen to what the elderly and the caregiver are saying. And sometimes they interrupt each other or they talk over each other, and we tend to let them vent out. And you try to really empathize with what they are saying to you. And when you're doing a physical examination, that's when your stethoscope is between the ears. And as you are trying to auscultate the lungs, the patients may be talking to you at the same time, or the caregivers might still be talking and you could not hear anything else. And you have to stop your examination and hear what they have to say. So these are the things that you are trying to multitask. And while the patient or the caregiver is trying to tell you their history or any concerns that they have, you are trying to type and document at the same time the conversations. So there are moments where there's too much multitasking is doing, to the point that certain things that the patients or caregivers are telling you, you could not really capture everything. And I think this is what most healthcare workers are actually experiencing. And you try to order investigations on a computer and document everything, including the management plans, as they are trying to talk. So within that 15 minutes, you have to do all this. So what some of us has done is that they try to just document in point forms. And then at the end of the day, after office hours, they stay back for another 1 hour to key in and document properly. So I try my best to key in and document at the same time, but it is very difficult to multitask. And within that 15 minutes, I have to sometimes explain the diagnosis of dementia, the natural history, progression, and complications of dementia to the patient and caregiver, and also reinforce the importance of being compliant to medications and the need to supervise medications for the elderly. That's not the end, because if I have a medical student or a junior doctor behind me who is observing the whole consult, I have to take the opportunities to teach them also. And not only teaching my fellow colleagues, but also teaching the patient and caregiver how to do simple exercises if they are very frail and how to improve their physical health. So in essence, it is like we are the computer and we are trying to download many things at the same time and really doing multitasking. So where is our source of stress in this profession of caring? First of all is that we face challenging communications. We have to explain the diagnosis, breaking bad news to family members and patients also. And these are really, can be very difficult. And there's also communication with our colleagues and other healthcare professionals, which can also be very challenging if there's differences in opinion. Time is definitely a factor and it's a source of stress. There's a pressure of time because of the heavy clinical load. And sometimes the allocated time for all the consults might not be sufficient when the conditions are so complex that you need more time to spend with patients and their family members. There are also deadlines at the same time at work for submission of paperwork and various administrative duties. There's also a need to handle team dynamics because when there is a group of people, conflicts within medical team is inevitable and unavoidable. There is definitely differences of opinions between disciplines in the multidisciplinary team where people don't agree to disagree. And finally, we are all trying to navigate through technology because in trying to make things efficient, everything has been put on the electronic document. So we are trying to learn a new electronic medical system. And I think majority of the healthcare workers here would agree with me. We tend to spend more time in front of the computer than actually with our patients. And sometimes I am guilty of that too. So this picture, I'm sure a lot of you would resonate with the picture, and I know exactly how you feel. So you can see that there are two things that actually jutted out of the two figures back. I shall refrain myself from judging what are the two things there on the back. So there are some times when we are asked to do a certain task, and our common mindlessness approach is that we'll be asking, why was I arrowed? This is so stressful. I need to prepare. And oh no, I got no time to do it. The deadline is soon. So it reminds me of the time when Angie had asked me to give a talk on our inaugural Singapore Mindfulness Conference in 2018. And ironically, the title of the talk is The Effects of Stress and Mindfulness on Health. I was very stressed out preparing for the talk because I don't know what to expect. And I have just started on my journey with mindfulness practice. And it was really ironic. As I was doing the slides, I was feeling very stressed out. And yet I was trying to tell people that, stress causes all these ill health effects. But it gets better. In 2019, when I was asked to do mindfulness and memory, so I get more in tune with mindfulness practice and I was able to see things in a better perspective. And it slowly gets better in 2020, where we have our first virtual mindfulness conference because of the pandemic. And I've learned how to make it better. So this year, when Angie asked me to do a talk in this conference, all I said to her was, okay, sure. So there was no such thing as, oh, this is so stressful. But of course, internally, I was a bit stressed, but I think I'm coping much better now. Next comes to the part about the heart and the mind. So in this presentation, the heart refers to empathy and the mind refers to cognition. So how do we use our cognition in healthcare setting? The definition of cognition is basically conscious mental activities as defined by Merriam-Webster. And in layman terms, these are the activities of thinking, understanding, learning, and remembering. So in the true scientific definition by American Psychological Association, it means all forms of knowing and awareness like perceiving, conceiving, remembering, and problem solving. So there are multiple cognitive domains, and there's a few that is the major ones. So perhaps I'll just focus on 5 major cognitive domains. And the first one is basically memory. It is one of the most important cognitive domains because that's where people will be very upset or a bit frustrated when they find that they can't remember things. So there are the different types of memory. You have episodic memory, semantic memory, and procedural memory. So episodic memory means basically memory of events. For example, what you eat today. So if I were to ask you now, do you remember what you eat for breakfast? And do you remember how you get to the current place that you're in? So you should be able to remember if you don't have any short-term memory loss, okay? And what about semantic memory? It's basically memory on general knowledge that you have acquired since young through your education. For example, if people ask you, dogs have how many legs, then you will say 4. So those are actually semantic memory. And procedural memory are basically memory of motor skills, like how you learn to ride a bike or how you learn to play the piano since young. Next, we have the domain of language as divided into fluency, which is the ability to articulate your speech, whether you're able to understand speech, and whether you're able to repeat words and name objects. And one of the important domains is executive functions, which I will expound a bit later. So the components of executive functions are basically planning, organizing, problem solving, and decision making, judgment and impulse control. So executive functions actually are basically higher order of learning and thinking. And another important cognitive domain which is pertaining to mindfulness is actually complex attention. You have a variety of types of attention. You have selective attention, which means that right now you are hearing me present to you while you're trying to avoid any distraction from elsewhere. It could be noises outside or your kids around you as you're attending this conference. So that is selective attention. What is sustained attention is when you're trying to read a newspaper and you're focusing your attention for a certain period of time. Next is divided attention. That is actually multitasking, where you could be trying to write down notes at the same time as you are hearing this talk. And alternating attention is when you're trying to cook. For instance, you're trying to cook and you have a cookbook beside you. So your focus initially is on the cookbook, trying to understand the steps. After that, you move on to the frying pan and try to see how you're going to cook the dish. And then you move back to the cookbook. So at any point in time, you're alternating your attention. And finally, is perceptual motor function. It comprises of visual perception. It's basically, for instance, visual perception of colors, patterns, and structures around you. Visual constructional reasoning. For example, reproduction of any geometric figures using building blocks and copying a figure. And perceptual motor coordination, where you try to integrate the various sensory and motor abilities to carry out a physical activity. So in terms of trying to do walk rounds and clinic consult, there's a lot of executive functioning that is present and it goes into overdrive. So what I had to do is basically I had to have a working memory that is intact because I need to keep key information in my mind about patient's condition and trying to utilize it as I need it. I need to be flexible in my thinking. I need to plan and prioritize which patient I see first and how to plan out the management plans. I need to take action to get to get started on the task, organize how the walk round is going to be done. At the same time, I need to think before I act, and I have to be aware of how my team is doing, how myself is doing. So these are all components of executive function. Another important cognitive domain is actually attention. And there are 3 attentional networks in the brain. The first is the alerting network, where the state of alertness or vigilance will then help to determine how fast we respond to situation or question. Next is the orienting network, where it could just be a very overt thing where you adjust your head and eyes and orientate yourself to where the noise is. Or it could be entirely covert, where you just need to shift your attention to the door when there's a knock on the door, but you are still remaining fixed on the computer screen. And finally is the executive attention network, where it has its role in controlling distraction during task performance and in trying to switch between tasks to be completed. So we know that in terms of multitasking, it actually involves aligning our attention with alternating sources of sensory input. And sometimes multitasking might not be the best way to do a certain task very well. Although for certain people, it may be efficient. For others, it may not be very efficient at all. Next, I'll go on to the hard portion of the talk, which is empathy in healthcare profession. And I like this quote, which is, empathy is seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. And there are three types of empathy. You have cognitive empathy, compassionate empathy, and emotional empathy. So cognitive empathy is trying to understand how a person thinks and feels on a conceptual level. Compassionate empathy is beyond understanding. It means that we are trying to share another person's experience. And emotional empathy is truly connecting with the feelings of another person at the emotional level. And empathy actually requires our cognitive, emotional, behavioral, and moral capacities to understand and respond to the suffering of others. So it can be said that cognitive empathy can be really under emotional, and emotional empathy can be viewed as over emotional. So, how do we strike a balance between logic and emotion? And that's when we try to exercise compassionate empathy. So, sometimes our patients don't need us to understand or feel their pain or cry with them. All they need is for us to understand and sympathize with what they're going through. And either we take action or we help them to take action to resolve the problem. And that is what compassionate empathy is about. Another part of it is that it's been reported that our capacity for empathy actually deteriorates because of the degree of emotional labor that we have expended already. That means we are totally emotionally exhausted. And that's why it's very important for healthcare workers to exercise self-care to maintain a high level of empathy. And there are studies that show that empathy actually declines during medical training. So self-empathy is definitely a much neglected area among healthcare workers. And it is very important to provide empathetic, it is very important to provide self-empathy to ourselves before we can provide empathetic care to others. So some ways in which we can do self-empathy include, number one, try not to compare yourself with others. It is very difficult. It's easy to say because I do that sometimes. I tend to compare myself with others, but after practicing a bit of mindfulness, I put a stop to it after some time, but it tends to recur again. But I think it's okay as long as we try our best. Number two is try to forgive yourselves more. Certain things that you do at work might not be up to your expectations. It's okay, forgive yourself. And that's self-empathy. And the third thing is also not to be so judging of yourself. Try to do less self-judging and not try to do a lot of self-beating. So what I reckon is that when you have self-care and self-empathy, that's when your empathy bank is very high and your emotional bank is high. And when it is high, then you're able to empathize others. Similarly, when you love yourself, can you then love others? When you care for yourselves, can you then care for other people? What I like about this paper by the author Vajja is that he or she state that empathy is not thinking. In fact, it is a shift in consciousness, not cognition. And it's one that actually puts under the microscope our emotional, psychological, and spiritual orientation to others around us. And it is this internal exploration that is very quiet, slow, continuous, and in fact intentional, very purposeful. And it's not thinking about, it's really not intellectual. And we tend to query our hearts and not our minds in empathy. And I like this quote from the author. I quote, our mean-spiritedness, anger, mistrust, and intolerance will not be eliminated by cognitive understanding because true empathy is not a matter of cognition. The common ground we need to find is not in the real estate of the brain, but in the fertile fields of our hearts. That sentence, I feel, is so powerful that it is so beautifully written. Next, how do we nourish our heart and mind through mindfulness? And we know that mindfulness is an old tool to enhance life by reducing automaticity. So through my readings, I realized that there are two types of mindfulness. It may have been touched by other speakers. You have meditative mindfulness, which is introduced by Jon Kabat-Zinn. And then you have social cognitive mindfulness, which is introduced by Langer, and it's a non-meditative aspect of mindfulness. So for the meditative aspect is where it requires a discipline of anchoring your mind in the present moment, where you pay attention in a particular way on purpose in the present moment and non-judgmentally. And is to accept that whatever that we are experiencing in the moment by letting go of any evaluation or judgment. So what about social cognitive mindfulness? It actually emphasizes on the cognitive categorization, the context, and situational awareness. It requires us to broaden our repertoire of cognitive categories. For example, if we describe someone we dislike intensely, we'll just use like a single statement to describe it, right? But if we are forced to describe the person in great detail, eventually I am sure there'll be some quality that we appreciate of that person. And it doesn't mean that we dislike that person in the entirety as a human being. So Langer actually states that when we are mindful, we implicitly or explicitly view a situation from many perspectives. We see information presented in the situation novel, meaning that there's no prior judgment, no biasness before. And we attend to the context in which we receive the information or perceive the information, and we create new categories through which we can actually understand the information that is presented to us. So in essence, Langer's view is that being mindful is an orientation to being attentive no matter the context. And we are encouraged to develop cognitive flexibility and curiosity to each situation that we encounter. So there's a lot of similarities between social cognitive mindfulness and meditative mindfulness. And the common mechanism that they rest on is actually self-regulation of attention. And if I were to ask you, what are the 3 types of attention networks? I hope you can remember and that you're already mindful of this presentation, right? Okay, so the similarities of these 2 types of mindfulness is that there's awareness of the present and looking at the context of the information as a novelty without putting in your bias, judgment, or any prior information that you know about the particular situation or person. And with curiosity, you try to engage the situation or the information that you're presented upon. And that's where I think social cognitive mindfulness is a more of changing your way of thinking, is changing your perspective, reframing a certain way of approaching towards a situation. So what about this mind-heart connection? We know that it's a reciprocal relationship between the mind and the heart, where heart conditions can lead to negative psychological states like depression, and negative psychological states can increase the risk of heart disease. So if we were to be able to handle all the stresses in life and improve our psychological health, we know that it can decrease the risk of heart disease. So where does mindfulness come in this mind and heart connection? Empathy actually requires the hallmark elements of mindfulness, and that is attention and flexibility. So in order for us to be empathetic, it requires us to actually direct our attention towards another person, while at the same time being cognitively and emotionally flexible regarding the other person's potential inner state, and at the same time being aware of our own state of mind and emotions. And it has been reported that mindfulness-based stress reduction program, which is a form of meditative mindfulness program, has been found to increase empathy in nursing students and faculty members. So in fact, right, empathy itself is a learned behavior, although the capacity for it is already inborn. So it can be further enhanced by mindfulness practice. And it's just like a seed where you need water to grow and make it into a seedling, eventually become a plant and a tree. And mindfulness is one tool that we can actually use to enhance our empathy. Next, I will share with everyone how I try to incorporate mindfulness in clinical practice, but this is my interpretation and my way of, and I try to make it into my way of life. So how I anchor this is by utilizing the foundational attitudes of mindfulness, such as kindness, non-judging, acceptance, gratitude, letting go, and focus on what I can do. This is what I learned from the foundational course that Angie had taught me a few years ago, and it has stuck with me for so long. And how I try to go about it is that, for instance, for kindness, I try to be kind to others who have hurt me by forgiving them. If not, I cannot let go. I couldn't find peace within myself. I also need to be kind to myself. And how I achieve this is through self-care and self-empathy. And I need to be very kind in the words uttered by me to others, because I need to be mindful of my speech so that I don't intentionally hurt other people. I need to be non-judging of others when gossips are floating around, and also non-judging of the situation until I know fully what's going on in the context. And importantly is to not be too judging of myself when I make mistakes at work. Acceptance. Need to accept that there's a lot of complexity in certain decision making for my patients or certain administrative duties that I have at work. And there's a lot of uncertainty in the workload during pandemic. Sometimes the workload is very high, sometimes it's very low. I need to accept that. And I also need to accept the limit of my abilities and seek help when I need. There's a lot of gratefulness for the trust to heal other people, for the help from colleagues when work is truly overwhelming, and also for the opportunity to care for others instead of being cared for. It's the every little thing in life that we need to be grateful for. And I need to let go of situations that are beyond my control. And I will let go of anger or disappointment with myself or others, and of control so that others can perform their job. If being a senior person and I tend to micromanage many things, I will not be giving my junior ones the chance to show their talent and potential. So I learned to let go slowly during ward rounds, during some of the teaching sessions, and let the junior actually show their potential. And I try to stop ruminating on what I cannot do at work and showcase my strengths and abilities, and also perform to the best of my ability and not half-hearted. This is where we focus on what we can do. So these attitudes have become my way of life and how I view things or situations over the years. So there are times when I feel angry, upset, or about to react negatively to someone. And the first thing I notice is that my face will feel flushed, my heartbeat will start to rise, and my face will clench. So I know that I'm going to get angry, but before I acted upon it, what I tend to do is to stop and just breathe 3 times. It's the awareness of you trying to have these negative reactions, and you stop it immediately. And then you start talking after you have calmed down. That helps a lot. And regular practices of deep breathing can help actually create anchor points for me to check in on thoughts and behaviors. And mindful speech is something that I try to practice every time, because before I speak, I ask myself these questions. Is it true? Is it necessary? And is it kind? If any of the checklist is actually not true or not necessary or not kind, then I try not to talk. And I think this serves me as a guidance in how I interacted with my patients, caregivers, and with fellow colleagues too. Next, how do I apply the social cognitive mindfulness, which is the non-meditative aspect of mindfulness? So I give you an example. Oftentimes we hear conversations where people start to say, this doctor is terrible and truly a bad doctor. And what kind of response do we get? People will be asking what happened. Then they will say, yeah, I agree, so terrible. Why did he do that? Or yeah, he is very bad. Why is he like that? It's like they have prior judgment and bias towards the person because of previous bad experiences with the doctor. And some even say he's always like that, cannot change. This is judging already. But I think the mindfulness approach using the social cognitive mindfulness is that doctor truly a terrible and such a bad doctor? We ask ourselves. So applying this social cognitive mindfulness is to ask ourselves, what is the context for such comments, where we want to treat every information as new, as a novelty. And the next thing is, what are the terrible or bad things done by this doctor? And that's when we want to categorize the information. And do the others who experience at that point in time agree with the view? And that's where we need to view things from different perspectives and view the situation differently and reframe our perspective. Then there are situations when a junior or colleague had made a mistake at work. So what do we do mindlessly? We tend to scold them. We say, why did you make this mistake? It is so simple, yet you cannot even send a simple email properly. Or we can even say to them, I can't trust you with a simple task, so incompetent. It is very hurting. So a better mindfulness approach is that to admit that the mistake has already occurred. It's considered in the past already. There's no point in trying to dig the wound and cause a person to feel so bad. But what's important is to move forward and to go through what had led to the mistake being made in order for the individual to learn from there. And I thought this is something that we have to constantly remind ourselves. It's not to keep dwelling on the mistakes, but to help the learner or the individual learn from it. Next is mindfulness and self-reflections. And I found that mindfulness actually promotes reflection, body, and mental awareness. And self-reflection to me is really the key to self-awareness because it allows us to look very neutrally at our thoughts, feelings, emotions, and actions, and also look at ourselves with a lot of interest and curiosity. And I find that there are many benefits of reflections, like improve myself through learning from my mistakes, provide me with a lot of perspectives, makes me happier, and encourage me to help others and gives me really creative ideas. And mindfulness can be used as a tool for self-reflecting, leading to mindful self-reflection. And reflection requires time and space. So it's like trying to deliberately view things from different perspectives and with empathy. It's the stillness and quieting the mind that foster even deeper reflection. And when impulsivity is about to occur, mindfulness allows us to redirect the mind towards reflection. But reflection is not this, and I'm sure a lot of people will know what this is. Reflection is actually not rumination. Reflection actually leaves me feeling more positive and hopeful. Rumination really leaves me feeling defeated and stuck in the past. And I find that through mindfulness and regular reflections, there's less rumination, less self-beating, easier to let go of the past events or mistakes made, and mentally less exhausted. And finally, just 3 more reflections that I would like to share with you. And I encountered this quote in a program where the person said, to patients, illness is despair, but doctor is hope. And I thought it's really powerful. So the first reflection is finding meaning in the profession of caring. Sometimes the going may get tough daily, the daily clinical grind at work, and I've reached the bottom. But I try to reflect and I try to find out why I wanted to be a doctor in the first place and find that actually it is a calling to me and there's a sense of purpose in life. And the work that I'm doing is meaningful. And just going through this reflection really helps me be strong, resilient, and at the same time keeps me going. And I remember Angie told me this 3 to 4 years ago. Not everyone has the privilege of caring for others who are not their family, relatives, or loved ones. This advice by her really stayed with me throughout all these years when things are so tough. And my second reflection is to be humble to admit that patients are our teachers. So it's truly thanks to my patients that I learn how to deliver compassion and be empathetic in the best way possible. And thanks to them, I learned how to manage medically and socially complex conditions where patience is really the essence. And thanks to my patients with dementia, I learned how to see a person behind the diagnosis of an illness and respect personhood. And thanks to my elderly and frail patients, I learned how to be more appreciative of my aging parents and be there for them in their silver years. And finally, the third reflection is to be forgiving to others while delivering care and seek forgiveness when required. We need to forgive our colleagues or any healthcare staff who may be harsh or unpleasant at work, or it could be their tone that they use on us. Only then can we find peace. And we need to forgive patients or caregivers who may be venting out their frustrations at me. Currently, I'm doing almost like COVID-19 work, and I was just shouted at yesterday by an agitated patient. But thankfully, mindfulness teach me to really stay calm no matter what. The higher his voice goes, the lower my voice become. In the end, he really looked pretty silly when he's just shouting and screaming. And forgive myself when I don't feel my performance at work has been optimal, less self-beating, and seek forgiveness from others if mistakes have been made or I have not been mindful with my speech or actions, and apologize if I've articulated my words wrongly today. So in summary, I hope the information has been bite-sized. Being in the profession of caring does not mean one stop caring for oneself. And mindfulness can be a bridge between cognition and empathy when one encounters challenging tasks or conversations. And I find that mindfulness puts a framework to one's perspective, and it's really up to us to make it a way of life. And taking a moment to reflect is almost akin to pressing the pause button at the end of the day. So this is my third last slide. I like to share this starfish story. So you have this old man who walked the beach at dawn. He noticed that a girl ahead of him is picking up starfish and flinging them into the sea. Finally catching up with the girl, he asked why she was doing this. She answered that the starfish would die if left until the morning sun. But the old man said the beach goes on for miles. There's so many millions of starfish. How can you make any difference? The girl looked at the starfish in her hand, threw it safely into the waves and said, it matters to that one. So I know I cannot make a difference to many people, but at least I try to make a difference to every patient that I see at work. And similarly, through this conference, I hope that I can at least make a difference to one of the attendees, at least one of you, to promote that reflection, to promote that introspection, and also something that I've learned from this sharing. And finally, I guess that before the presentation, this is your baseline knowledge. First 10 minutes of my talk, I think there's a lot of information that you're trying to absorb and knowledge is there. And at the end of the talk, I'm very sure that if most of you have let it go already. I may not even remember what I've mentioned earlier on, but it's okay because at the end of the day, your knowledge is much higher once you consolidate the information and when you have gained a good amount of knowledge. Thank you very much.